So, welcome to another edition of FFRF's Ask an Atheist on Facebook Live. I'm Dan Barker. I'm co-president of the Freedom from Religion Foundation, which you viewers, you regular viewers know, we work to keep state and church separate and to educate the public about the views of freethinkers, which are atheists and agnostics.
And I'm Rebecca Markert. I'm the legal director here at the Freedom from Religion Foundation. As always, you can feel free to send in your questions by posting in the Facebook comments below, or you can send an email to askanatheist@ffrf.org.
So as you can tell, Rebecca and I are working remotely from our studios, our fancy studios in our homes. And so, Bruce, I don't know if you can hear me, but it says this is Ask an Atheist number 229. Is this really show number 229, or is that just your numbering
It's 100.
system?
You started at 100, but it's the 129th show.
Oh, 129th show. Okay. Well, we've been going for quite a while here. And say hi to Buzz. Buzz Kemper is social distancing, but still in the studio with you doing audio.
Hi, Dan. Hi, Rebecca.
Hi, Buzz.
Hi.
So there's only one more shopping day left until tomorrow, May 7th, which is what? Tomorrow's the National Day of Prayer. But do you know what today is? Today is May the 6th, and today is National Nurses Day. It's actually the first day of National Nurses Week, which starts today and ends on May the 12th.
And to honor those nurses who are on the front lines, in a few minutes, we are going to talk to an ICU nurse who is currently taking care of COVID-19 patients in the Washington, D.C. area. Not all of those nurses are religious. Ovais Khalil is a nurse who started a group for humanists in healthcare. He has a great story to tell. But before we bring him on, we do want to talk about what's going on tomorrow.
Tomorrow, the National Day of Prayer, which our president has declared since the 1950s. But now, it is also the National Day of Reason. Representative Jamie Raskin from Maryland and other members of Congress who are part of the Free Thought Caucus in Congress, they have introduced House Resolution 947, which says, expressing support, as it says, for the designation of May 7th, 2020 as a National Day of Reason, and recognizing the central importance of reason in the betterment of humanity.
And this is a historic resolution. One of the many wonderful whereas clauses in the bill says this: whereas irrationality, magical thinking, and superstition have undermined the national effort to combat the COVID-19 pandemic, and reason is fundamental to creating an effective, coordinated response to beat the virus involving the federal government, the states, and the scientific and medical communities.
So isn't that nice? You know, we see all these resolutions about in God we trust and Bible and all this religious stuff. Now from our own Congress, we have a resolution recognizing the importance of reason. And the resolution talks about our founding fathers, about what they used reason, and about the importance of basing our policy and our laws on good common sense. So Annie Laurie, who is co-president of the foundation, is working on an ad for the New York Times. And at the last minute, when we saw this resolution that came out, she was able to insert some of that wording into the full-page New York Times ad that FFRF is running tomorrow on the National Day of Prayer, which is now also the National Day of Reason. So you are the first to see this ad. If you subscribe to the New York Times, you can watch for this tomorrow. The ad says, "We need reason, not prayer, to combat the coronavirus." And further down, "Nothing fails like prayer. Science works. May reason and our secular constitution prevail." And you can also see that the ad has this brilliant, eye-popping cartoon by Steve Benson, who drew this just for us. Jesus is being wheeled into a COVID ambulance saying, "Is there a doctor in the house?"
And I'm not sure if everybody can read. On the side of the ambulance, it does have WWJD. Who would Jesus dial? 911.
So even Jesus, if he existed, would realize that we better take advantage of reason and science. So if the patient, whoever he or she is, wants the best medical care they can get, they have to rely on the health professionals. They cannot rely on prayer. Prayer might make them feel comforted maybe, or it might give some people some hope, but prayer doesn't change the laws of nature. So we're going to hear from a health professional in a few minutes, from Ovais Khalil. But before that, Rebecca, you have an FFRF victory to report, a recent victory that has to do with Bible study and prayer.
That's right. So last week, our legal department secured a victory in a lawsuit that we had against the housing agency, the Federal Housing Agency. As our viewers may remember, in 2018, FFRF sued HUD along with another watchdog organization called CREW, that's the Citizens for Responsibility and Ethics in Washington. We jointly sued the agency over denial of records relating to the White House Bible study and Secretary Ben Carson's attendance at a Museum of the Bible event. What we discovered was the housing agency had a pattern and a practice of denying records by refusing to waive the fees that are associated with gaining access to those records. They give out fee waivers to indigent people and also nonprofit organizations, but they were refusing to do that here. And what would happen is they would decide to refuse to release the records and grant a fee waiver if the disclosure of those records was going to cast the agency or Ben Carson in a bad light. So we sued, and we were able to settle that lawsuit with the agency last week. During the course of litigation, we were able to receive the records. But most importantly, the big success of this lawsuit was the access to records that the public now has. The agency agreed to do an in-person training for all of its employees on fee waivers and what's appropriate and what's not, and to update their guidance on when to grant waivers and when to not do that. So we were able to secure the records without charge, as we were supposed to have been granted originally. And going forward, we've really ensured that the public has access to crucial documents that our federal government has.
So this is a great victory for sunlight in our government and in our policies.
Exactly. So, and for FFRF, I mean, we rely on public documents a lot in our legal work because we use them to find out what's really happening at these agencies and in our federal government. When we made the request, we were trying to figure out if there were any government resources going into the White House Bible study. And we wanted to know about the invitation to the Museum of the Bible event. What sort of government agency and resources were used there? What do the taxpayers have to fund for this Bible study? Are staffers required to participate or compelled to organize something like that on the government dime? So these are important records that we use in our own work, and having access to them is really important for us to keep state and church separate.
So a number of FFRF attorneys who worked on this specifically. Was it you and who else?
It was not me. It was our senior counsel, Patrick Elliott, who worked with CREW on this.
And CREW has their own attorneys also?
They do. Actually, they have a lot of really good attorneys. And our friend and law professor, Erwin Chemerinsky, is on their board. And he is, people may know, is one of the prominent constitutional lawyers in the country.
So what's the next step? We are now proceeding through discovery, and we're going to continue with legal action on this?
Well, nope. We have settled the lawsuit, so we are dismissing it because we did receive the records. So there's nothing further to go to look into. We received the records. We got what we wanted. Plus, we got this training and this new assurance that records are going to be accessed by people when they ask HUD for them. So it was a big victory for FOIA and sunshine in our government, like you said.
But what I mean is, what are we going to do with the records now?
Well, we've been combing through them to see if there's anything there. And if there is, we will definitely take action on that. And we're going to continue to monitor HUD and the White House Bible Study to see if government resources are being used and if any of the staff are forced to participate or forced to organize something like that. And we will certainly take action if that comes to light.
So stay tuned, in other words. Huh?
Exactly, yes.
Yeah. Okay, well, thank you, Rebecca, and thank all of the legal staff. Everybody's working remotely, all 30 FFRF staff, and somehow it's very quiet in your house there, Rebecca. Usually when we communicate, one of your kids is running through the screen, but you must have found a little...
Well, it is about lunchtime, so right now they have finished their schoolwork, and it's a beautiful day outside today here in Madison, Wisconsin, so they are outside running around. But they probably will be busting in at any point. Earlier in the show, my oldest son, Dexter, who's 8, came in to throw my phone back at me. So you might see them.
Oh, good. I hope they do pop in here. Okay, so now, thank you. So now to the main event for today's show, a freethinker, a humanist who is a nurse who's right now, as we speak, working to battle the coronavirus.
Yes, Ovais Khalil is a man with quite a story. After serving in the U.S. Marine Corps, he went from a job as a computer professional to become an intensive care unit nurse. He's now working on the front lines of the COVID-19 epidemic in Washington, D.C. He's working today, so Dan got a chance to talk to him yesterday via Skype.
So, Ovais, thank you for joining us today.
Thank you for having me, Dan.
So you are a nurse right now on the front lines in the D.C. area, is that right?
Yes, I am.
You work in emergency room or intensive care, or do you work with some of the COVID patients?
Yeah, I'm actually an intensive care nurse. My unit has recently been, we more or less the COVID ICU because just about every patient these days are COVID. About, I would say, 19 out of 20.
Wow. So how are you faring? I mean, I've been seeing stories about a lot of stress among healthcare workers. How are you faring?
That's interesting you mentioned that. You know, that's something that my wife's a mental health counselor, and I see a regular counselor, and for me, it's just you need to have those stress reliefs. I encourage every nurse, every doctor to go to talk to people at times because this is a very difficult time to live in.
Are you afraid?
To tell you the truth, yes and no. I want to be out there for my patients, and I think that when I'm there, I'm not as much. My biggest concern really is my wife and my dog.
Yeah, you don't want to transmit it to someone else. Right.
Exactly.
So maybe you don't believe in God, but you do believe in dog, right?
Yeah, that's a good way to put it.
Yeah. So you and I talked years ago. I think you called me or something having to do with a debate I did in South Carolina in 2009 with Kyle Butt, who is he Church of Christ?
He is, yes.
You did not attend the debate, though.
No, I was actually a fundamentalist Christian until like really 5 years ago. But I looked that debate up, and that's where I've recently started hearing about you. And then also, so it took me a while before I actually ended up making the call. And then I also saw you debated Dinesh D'Souza and then refused to debate with him again. And I knew I respected you from that moment forward.
Well, he and I did Dinesh and I did 8 debates in as many states. And it was collegial, but then after a lot of this information came out about how sleazy he is, and I said, no, there's no way I want to keep debating him. But so what happened with you? How did you change your mind?
So for a long time, I used to believe the Bible had no mistakes, no errors, was the Word of God. Now, also there was, for me, I came down with a pretty life-threatening illness at a very young age. I was 20 at the time, and that was something that changed my life. I thought originally that the reason I was healed was God. Of course, later in my life, I looked at what was that other people who don't survive, people who were perhaps more worthy than I was, smarter than I was, and could make a better impact. And unfortunately, I had a hard time with the suffering in the world. It really kind of shook me. I tried going to the Bible. Then I started discovering errors that I just couldn't shake, and so that started questioning. And then the fact that there were so many denominations, somebody interprets this verse this way, verse that way, and eventually ended up me leaving the faith altogether.
Yeah, so I went through the same struggle. I used to be a evangelical like you and preaching, and it was not easy. You don't just snap your fingers one day and go, "Oh, silly me, I don't believe anymore." It was quite a agonizing psychological journey to rebuild all of that. So it looks like you came out fine on the other end.
I did, and I don't know if you saw my interview with Aaron Ra. We actually talked afterwards, and I mentioned to him, it just helps so much. My marriage is just amazing now. The way I communicate now with other people, treat other people, it's just I'm overall a better person after leaving religion. Dealing with mental health issues and getting the help I need, with true ways instead of just trying to pray it all away or just trust in Jesus or whatever the hell that means.
So you were in the Marines. My brother was in the Marines. My son was in the Marines, and now I have a grandson who's in the Marines, and they're all can do. They have this attitude of we can do this. So it looks like you have a similar attitude. But then you went into nursing instead of the ministry because you felt a higher calling. Is that what it is? Or a lower calling, maybe?
It was so when I got out of the military, I worked in the computer industry for a while, but I didn't really feel fulfilled. And, now that I think about it, I called you when I was considering going to nursing school. Yeah, that's actually, now that I really do think about it. It was just around the same time. So I decided, after working in the computer industry for a little bit, I realized I wasn't happy. I felt God trying to lead me into the ministry. I thought that was the way to go, but I realized it wasn't going to make the impact. So I decided that I'm a very empathetic person, and I wanted to go become a nurse.
Wow.
Yeah.
And you got a PhD then in nursing?
Oh, no, I don't have a PhD. I'm going to start on my PhD program next year.
Oh, you are? Okay. Wow. Yeah. Well, you're dedicated. So I heard that you care so much about this crisis we're in, you decided you wanted to work with Samaritan's Purse, and they turned you down. Samaritan's Purse is that Billy Graham Association healthcare thing that were in New York City. They set up all those tents. You wanted to help them, and they turned you down. Is that right?
Right, because I told them I'm not a person of faith. And they said that, so I didn't speak with any higher executive. I just spoke with people who were recruiting. And they said, it really wouldn't matter. They said it wouldn't matter here as long as you can keep it quiet and you can just take part in the things. And I said, well, no, unfortunately, I can't take part in like the prayers and things like that. And then they said, well, then we really need somebody with Christian values. I got later told by one of my coworkers who does work with Samaritan's Purse that, that Christians have certain values that they can add into the nursing field. And I just had to think, what does that mean that I can't? That's I'm somebody who wants to go out there and help.
Wow. So they turned down a capable person simply because of your views. You could have been very useful to them, but they turned you down.
Yes, they did.
Wow.
It's something that I just never ceases to amaze me about believers to a degree. You know, it's I feel like it's in a way because if you look up right now, especially in the nursing field, Google atheist and nursing, you'll find the top articles saying, you know, nursing and atheism seem contradictory to one another, or this person who wrote a book called Nurses Are From Heaven saying that there's no atheist in nursing, like there's no atheist in foxholes. And like you'll find article after article about it.
Wow. So you have started a group called Humanist Healthcare or Healthcare Humanists?
Humanists in Healthcare.
Humanists in Healthcare. And what is that?
So what we want to do is provide opportunities for doctors, nurses, therapists, anybody who wants to use their amazing talents, and also technicians and people who just want to volunteer in the healthcare field, but just want to use their amazing talents to, in order to progress the healthcare settings, give charitable work, allow them opportunities to do charitable actions, and also organize different projects and give voice to these people. I have like an example of a project that we discussed in our first meeting is COVID packages. You know, actually creating small little packages and giving an example of what people should have in these little COVID kits at their house. You know, things like fever reducers, water, Gatorade. You know, just in case somebody does get COVID and needs to take self-care at home, or education pamphlets.
So is that just a D.C. area thing, or is your group a national organization?
So we are a national organization. We are hoping to be a worldwide organization because I've actually, since in previous interviews, I've actually been contacted by people all over the world, and I'm hoping that we can actually find a way in order to coordinate that. But so far, most of the people are within the United States.
So Washington area secular humanists, I know those are great people. I've been out there a number of times. They're associated with the American Humanist Association. So would this be like under their umbrella then?
So right now we do answer to, we are an organization that's underneath Washington Area Secular Humanists. So under that, yes, we are under the American Humanist Association through the affiliation that Washington Area Secular Humanist has with them.
So how can people reach you? You must have a email address or a website.
Yeah, so I believe you've been flashing up the website a little bit. So my personal email address to reach me for information about healthcare humanists is ovais@wash.org. OVAIS. Yes, sir.
OVAIS.wash.org.
Or at wash.org.
Or at wash.org. And they can reach you from that. We have a lot of members of our group who are in healthcare as well, so they would be interested about that. So I have a question for you. You probably saw that the Department of Homeland Security issued some guidelines last week recommending that clergy, especially hospital chaplains, should be considered essential workers. There's a memorandum right there from the cyber infrastructure part of it, and the acting director of Department of Homeland Security, Chad Wolf, issued these guidelines saying that in the hospitals especially, these chaplains are very, very important. What do you think? Is it important? Does it help to have chaplains in the hallways in the hospitals during this time, or is it better for them just to step out of the way?
So, in my opinion, hospitals give chaplains a role that they are unqualified for. Now, to allow a chaplain to be with somebody of faith to provide that comfort, of course, that's fine if that's of the particular faith. Personally, I think for a hospital to hire a chaplain to do that, probably not, but to get volunteers from the community, sure. Now, what I mean by the role they're unqualified for, most hospitals have their chaplains as the head of their ethics committee. And I don't understand a lot of times how a master's in divinity or a master's in theology makes you any more ethical. So So that's actually something I'm about to start writing about in a blog. Like I was actually thinking about that I need to write about this or take some sort of action, because when we make ethical decisions in the hospitals, a lot of times the chairmen of the ethics committees, and I'm not pointing any particular hospital out there, I'm saying a lot of hospitals do this, is they have chaplains at their heads of these ethics committees.
Yeah. So, we sent a letter of complaint to the DHS about this guideline that they should be considered essential workers. And we have actually a press release about that as well, if anyone's interested in more in this issue. Do you think the typical patient is encouraged or helped by a chaplain walking in? Do you think there's this idea that chaplains are somehow a man of God, that they're going to be able to provide some comfort? Or do you think the typical patient just wants to be left alone?
More than likely, the typical patient just wants to be left alone. It's definitely not an essential service. Most patients do not need that. And to tell you the truth, I don't believe that we should, like I said, hospitals should be hiring chaplains to begin with.
Yeah.
I actually there was a chaplain I knew who had a patient who was agnostic, who was actually on his deathbed. And it was just amazing for me to look at this whole situation play out, where these particular chaplains, there was a few of them, didn't know how to provide this guy comfort. And I was just like, you were not trained in this. Wow. I don't know.
Well, I'll tell you a story about my mom. She was in intensive care in Arizona and under sedation and in a bad place. And my dad had to drive home for a while. They had put down on their admissions form that she was an atheist. I think that's supposed to be confidential. 2 interns came into her room in the middle of the night and started praying over her. She was all hooked up. She couldn't move. She was under anesthetic or whatever. And they looked to her like demons were coming into the room, and they were trying to convert her, knowing that she was an atheist. Somehow that information got to the staff, and she said, "Where's my husband?" And they said, "Why do you want to talk to your husband?" They were viewing her as a mission field. Do you think that happens a lot in hospitals?
I have seen that happen so much that I'm impressed that how much it does happen. Unfortunately, you even have nurses and doctors doing this. I feel like a lot of times that people just let it slide because nursing is supposed to be the religious, kind of a religious profession in the healthcare field. The American Nurses Association themselves even have a spiritual dimension of care, which I disagree with. So, it just frustrates me how much this happens.
In my mom's case, what happened was counter-therapeutic. I mean, she was afraid. Her blood pressure went up. She wanted to get out of that bed. They were interfering with her health care, I think. So what about a patient who requests their own pastor or their own rabbi? What if there's somebody who says, I would really want the comfort of my own clergy coming in? Do you think that would be okay?
I agree with that, honestly. I mean, and I think that's the only role clergy should have in a hospital, because it's not I believe the role of the chaplain should be replaced with a mental health counselor, whereas clergy, if that's your clergy, if that provides you comfort, go right ahead. Just make sure they follow all the visiting hours rules.
Yeah. Well, Ovais, if you're like my son or my brother, you sometimes get tired of people saying, since you were a former Marine, thank you for your service. It's not so much the thanks they want. The veterans really want help. They actually want real, tangible help. But I can't resist feeling to say the same thing to you right now as another kind of soldier on another front line working in this crisis, to thank you for your service and hope you stay healthy and physically and mentally. Really appreciate what you're doing.
I appreciate it, Dan, and I appreciate all the work you do with FFRF. And I'm hoping that Humanists in Healthcare and FFRF have a long relationship.
So just to repeat before we say goodbye, how can people contact you?
You can contact me at my email address, Ovais, Ovais, @wash.org.
Okay. Or else you can go to the Washington area Secular Humanists, and they have a page up about humanists in healthcare. Well, thank you so much for being with us today, Ovais. It's been a real pleasure speaking to someone like you.
It's been a real pleasure talking to you, Dan.
So Ovais is not here with us today because he is working today to save lives. But if you have a question for him, we can get it to him. And Dan, we do have quite a bit of questions from the viewers if you want to take them.
All right, let's go for it.
All right. So the first one comes from Steve Savage. My wife is a practicing Christian, and we often get into heated discussions about the value of religion. I get frustrated when she and other of my religious friends say, "You have to have faith." This is totally alien to me, and I have a hard time responding without getting angry. What should I say to them?
Well, everybody has to take their own tack with their own relatives and friends and coworkers. But I would say that faith is not knowledge. Faith is an admission that there's something wrong with the claim. If the only way you can accept a claim is by faith, you're admitting there's something wrong with that claim in the first place, that it would need faith to be accepted. So most of us who try to think scientifically and reasonably, instead of using the word faith, we might use the word probability, let's say. Even scientists say we have a confidence level of 97%, 98%, and we're going to round it off, but we're admitting that we're rounding it off. We're not saying this is absolutely true, but based on evidence and observation and what we know about the laws of nature, we're going to say this is most likely true or most likely not true. We don't take it by faith because we are saying, however, we might be wrong. Very few believers say, I'm taking this on the probability, but I might be wrong. For most of them, it's not a gray area, it's a binary thing. So if faith is all they have, then they don't have that much.
All right. So the next one is from Stephen Hewitt. He writes, as a former recipient of the Atheists in a Foxhole Award from FFRF, the City of King is now pushing prayer even harder at council meetings. They have 5 city chaplains who give Jesus Christ invocations and now are reading scripture during council meetings. I guess it's not much of a question because he just ends it with, it's time for another lawsuit.
Well, hello, Steve. We remember you very well, and you're a very brave freethinker, a very brave plaintiff. But Rebecca, well, that's in your ball court.
That's true. Well, before I get to the idea of a lawsuit against the city, I do remember when Stephen accepted the award at our convention and asked how many people were veterans, and more than a vast majority of the people raised their hands. It was really an inspiring and awesome moment to see how many of our own members are former military.
Or current.
In terms of right, exactly. You're currently serving. But back to the lawsuit, really filing lawsuits against city councils and county boards right now is very, very difficult because we do have 2 Supreme Court decisions that allow for legislative prayer and that allow them to be particularly sectarian, meaning that they can be to Jesus Christ. It's still something that we would look into because, they can't be denigrating other religions, and there are still some limitations. But the Supreme Court in the last 40 years has made it very, very difficult for us to be successful in these lawsuits. As always, what FFRF would prefer to do is to not go to court over these things and send a letter of complaint to the city, reminding them that there are non-religious and minority faith citizens that they are also representing, and that the best course of action would just be drop the prayer altogether. So that would be our first step. But it's certainly something that we would look into to see if there is an avenue for litigation. And Stephen's always been a great member to help us with that. So we can connect with you on that.
Well, wouldn't Plan B then be equal time?
Yeah, I mean, that's a great point. One of the things that we've done since the Grease versus Galloway decision that came down a few years ago that allows prayers to be sectarian, they also in that decision said that one of the reasons this was upheld was because that they didn't discriminate against people who were not of the majority faith and even atheists. So we have done a nationwide push to get atheists, agnostics, and humanists to go before city councils and county board meetings and give a secular invocation. And we actually have an award that we give out, the Nothing Fails Like Prayer Award, for the best secular invocations that are given before these boards. So the next question, Dan, is from Rob Garmarillo. I'm sorry if I botched that name, but he says, didn't they have a day of prayer before the pandemic got super bad? And how well did that work?
That's true. You may remember on March the 15th, the Ides of March, right about the time that it started to dawn on President Trump that there was going to be a problem, there was almost 100 deaths in this country at that time. Trump issued a proclamation, and also he tweeted it as well, declaring March 5th a National Day of Prayer for God's protection, because we will prevail with God's protection. So they had that National Day of Prayer. And just look at the graph. What happened after that point? That was about 100, and then it went almost straight up to today. Very sadly, very tragically, it's more than 70,000. So the prayer did not work and does not work. I wrote a blog about this, which you can find on FFRF's blog called Free Thought Now. It's a Patheos blog, in which I argue that the coronavirus is proof that the Christian God does not exist, because the Christian God very clearly in many, many places in the Bible promises to answer every prayer of a believer with a definite yes. Not yes, no, or wait, but with a definite yes. Even Jesus said, all things whatsoever ye shall ask for in prayer believing, you shall receive. So I don't know how they can't understand the phrase all things. Well, obviously that Bible verse fails. The Bible fails. The faith in Jesus fails. So we need to put our faith and our trust, that's a better word, in reason and the scientific method.
That's right. So Phil Monroe asks, was the House resolution passed? That's obviously the House resolution we mentioned earlier in the show about the Day of Reason. So as we mentioned, tomorrow is the National Day of Prayer. And we got a resolution in the House to declare May 7th, tomorrow, as the National Day of Reason. And as far as I know, it was just introduced, and we are sending out an alert to our members, asking them to contact their members of Congress to get that resolution passed, but it hasn't had any movement as far as I'm aware. Do you know any more information, Dan?
We're watching the news right now to see what happens. We don't know.
Right. A lot of times these resolutions that declare a day to be something are usually introduced the week of. So if they were to pass, they wouldn't pass until tomorrow anyway. So it's important for our members to contact their members of Congress. Another question, Brad Letney asks, can we sue the churches? They claim to be essential businesses, but are not taxed. How is that possible?
Well, we can't sue the church unless the church does something Uh, but the problem with these guidelines about churches being essential places of business is that what is a church? No church has to actually prove itself to the government. You or I could start a church right now. We could just announce we're starting this church of free thought and we're going to start meeting. So I don't think we can sue. Our group would only sue the government if the government were in some way advantaging or giving preference to religion, which in many cases they do. So we're putting pressure on as much of the government as we can to discourage those guidelines, to make sure people do stay home, to make sure that faith doesn't increase the risk of infection.
And we are getting involved in some of these lawsuits because the churches are actually suing the government because they want to be able to have their worship services and have these large gatherings, which in many states they're prohibited from doing because they are too large to be gathering at this time. And so they've been suing, saying that they should be able to do that and to prohibit them from gathering like this to worship. It's violating their First Amendment rights. And FFRF had written a letter to all 50 governors saying that these shelter-in-place or safer-at-home orders should include churches because a lot of these gatherings do produce community spread, and a lot of people are getting sick from them. So it's not only a wise policy for them to take, it's also constitutional. There is case law that allows the government to prohibit worship services if there is a compelling interest, and the compelling interest here is to protect our public. So that is something that we're active on. We've been submitting amicus briefs in these cases where or we're going to be submitting amicus briefs in these cases where the churches are suing the government because they want to be allowed to gather and worship during this pandemic.
And there's even a Bible verse. There's a Bible verse that tells Christians to be subject to every ordinance of man. So they're not even obeying their own scriptures.
Right. This is why it's so great to have you around, Dan, because you can tell us what's also in the Bible. I wouldn't have known that.
Well, there's also another Bible verse that says, where Jesus said, where 2 or 3 of you are gathered together, there I am in the midst of you. So apparently if it's just one person, Jesus can't be there. So they have to have at least 2. But what kind of God is that can only be worshiped if people come together to worship him? I think it's the kind of God who needs money, who can pass a collection plate.
So the last question we have for today is from Haley Fisher. Doesn't FFRF have a huge Atheist in Foxholes statue? I thought I saw it on your Facebook page before. Is it possible to visit it? Of course, once it's safe.
We have 2 of them, actually. The first one went up in Alabama on the site of our Free Thought Hall down there near Talladega. It's a huge monument with the members, all the forces of the military mentioned, and veterans and active military sometimes visit that Atheist in Foxhole monument. But we now have a new one 5 years ago in our building in Madison, Wisconsin. I wish we had a photograph of it. It's a beautiful granite, taller than me, a big granite marker that has some wording on it that Ann Gaylor wrote, recognizing the contribution of atheists in foxholes, which means atheists in atheists in Humvees, atheists in whatever, atheists who have served and who are patriotic and who love this country. So you can come to visit our hall. In fact, you can just come stand outside the building right now and take a picture of it. It's out in the patio courtyard outside of our building.
Yeah, actually, my office window overlooks the monument. So when I look up from my computer, I can look out the window and look down and see it. And I often see people walking by and they stop and they look and they read it. And there are a lot of times people take pictures of it. So it always feels like we're finding more friends when they pass by our office.
Yeah, and sometimes better. They will come stand by it to get their picture taken by it. So.
Right. Well, that was the final question for today.
So I guess that's our show. If you have more questions for Ovais Khalil, you can send them to askanatheist@ffrf.org, and we'll see if he can respond to them next week. And those of you who watch our national television show, Free Thought Matters, which is on the air in, what is it, Bruce, about a dozen cities?
11
cities around the country, and then it goes on YouTube. Free Thought Matters. This Sunday, we are featuring the author Catherine Stewart, whose latest book is called The Power Worshippers: Inside the Dangerous Rise of Religious Nationalism. And if you watch the show this weekend, she exposes how the religious right is using sexual politics to keep their base riled up. So, is that our show for today? Anything else, Rebecca?
I don't have anything.
No kids to come through?
No, they're super quiet.
Well, tune in next week, 12 noon Central, for another episode of Ask an Atheist on Facebook Live.